Welcome back to The Ed Show. You know, I think there's nothing more important than health care. Failure absolutely is not an option. And you know the Republicans aren't coming up with a plan. In fact, during their pizza party on Saturday, Eric Cantor was asked about health care. Did he provide any solutions? No. Here's his answer.
We ought to be promoting anything that can try and bring healthcare costs down at a point, though, where we want to maintain the quality we've got. So when we're thinking about coverage, let us bear in mind the systems that we see in other countries such as the UK or Canada. We want the people, everyone, to be covered, but in a way that provides them access to quality coverage, not government takeover of their health care.
There you go. Another shot at the Democrats. You know, this is what infuriates me, is that government is just such a bad thing, that having your bill paid is a bad thing. How come we don't have a bunch of Canadians leaving Canada just roaring into the United States because health care is so bad up there? Our next guest has a lot of plans and a lot of expertise to go along with it. Joining me now is Mr. Howard Dean. Dr. Dean, Governor, great to have you with us tonight.
Thanks for having me on, Ed.
What do you have going tonight? I know that you're really pushing hard. You got something online tonight. Tell our audience about that.
We've got standwithdrdean.com. This one is it's a half-hour discussion sponsored by Move On and Democracy for America out of Burlington, my old campaign from 5 years ago, and it'll ought to be fun. Look, we're going to do health care reform this year. The president wants to do it. And it's going to have a public option. I'm delighted to hear that Eric Cantor is going to be supporting it. Isn't that news?
Well, you know, you get mixed signals from the Republicans, but the one thing you do get is constant vilification of any government involvement at all, although there are millions of Americans who feel very comfortable with Medicare. Dr. Dean, tell us, what do you think the proper mix of involvement should be in solving this problem?
Well, I think we ought to leave that up to the American people. We think we ought to give them both options. Let them keep what they have if they like it, or let them sign up for a public health insurance program like Medicare if they don't. Medicare, everybody understands, it's been around for over 40 years. Didn't get any Republican votes back in the 1960s when we put that in either. But it works well, and older folks are secure in their medical care now. So now the question is, are we going to let Eric Cantor and the Republicans and the insurance companies decide what people are going to have for their health insurance, or we're going to leave that up to the American people? I think the American people deserve a choice of a public health insurance option if they want one, or keeping what they have in the private insurance section if they like that. That's a fair thing.
Well, Governor, Dr. Dean, there's a lot of rattling out there about single payer being taken off the table. I don't know why the Obama administration has taken single payer off the table. How do you feel about that?
Single payer is not off the table.
It's not?
No, single payer already exists for everybody over 65. What Obama's plan essentially does is give you the choice of whether you want to be in a single payer or a private insurance market.
Okay, so I could go single payer then. Is that what the president's going to be putting forward?
No, the president's going to put together a plan that has both a public health insurance program, which is essentially a single payer like Medicare, and a private sector health care plan, and you can choose whichever one you want.
Well, you know where that's going. People are going to go, the majority of Americans are going to go with a single payer.
Well,
now, here's what I don't get. Why haven't we seen any actuaries about what this is going to cost to combat these righties out there who are just tearing this thing apart?
Well, look, we don't think that these folks are getting anywhere. I think that when the president got elected, he kind of put an end to this kind of culture of noism, and the Republicans haven't got the message yet. All they've said is no for 4 months, and I think the American people are getting sick of it. They want a real solution. I think the president's got a real solution here.
Do you think it can get done this year?
Yeah, I do. I think it can get done this year. There's going to be some resistance among the insurance companies and the Republicans and the Democrats who like the Republicans, but I think in general we've got to have a real health care reform bill, and you're not going to have a real health care reform bill if you keep pouring money into the system that we already have.
And now, would Arlen Specter be one of those Democrats that likes Republicans too much, or do you think you can count on him for health care reform?
I think we can count on him for health care reform, and the reason I think so is if he doesn't want to do health care reform, my guess is he can't win a Democratic primary.
That would be a big one. But I hear it every day. I mean, people want this done. From a political aspect, why would the Republicans not want to signature some kind of success in moving health care forward in this country? They've yet to really offer a plan, Howard.
The problem, Ed, is understandable. It's foolish politics, but it's understandable. They just suffered a terrible defeat. They've got to get their act together, but their party has shrunk so that the far right now is the vast majority of this party. And they can't win elections that way, but they can't seem to get out of their own way. It's, you know, we had to go through it in the 70s when the left was too strong in our party, and now we've moved back to the middle thanks to Bill Clinton, of course, now Barack Obama. And the country has moved, too. This younger generation is the center-left generation.
They want it.
They're multicultural. They don't have these ideological hang-ups that our generation did, either on the left or the right. They want progress. They want something done, and I think the President and the Democratic Congress is going to do that thing, whether the Republicans want to join us or not. We'd love to have them at the table, but so far all they've said is no.
Governor, good to have you with us. Good luck on your event tonight. It's a great thing. Thanks so much.
Thanks for the opportunity.